Viewers, namaste. GB syndrome has made a havoc at Pune region. And currently, if you talk about GB syndrome numbers, it has crossed 100 if you talk with reference to Pune region. In Maharashtra, the cases are more than 125 with two deaths in recent past. Now, one question which is coming from public at large is, are authorities really working on this to help people to save their lives and to get clean water and basic amenities so that people should not suffer GB syndrome because of especially water issues or contaminated water in their region? I have with me Mr. Shekhar Singh, who is Pimpri Chinchwad Municipal Commissioner. As per our records, as per health records, Pimpri Chinchwad has around 13 cases as of now. Let's check with Mr. Singh what exactly in terms of efforts done by PCMC to deal the situation. Over to you, sir.
So Tikam, overall we have currently 13 patients in our hospitals, in wards and ICUs, etc. Overall, if you look at the situation, we do not have a cluster situation. So PCMC does not have a specific cluster from where we are getting a lot of cases. The case numbers are also quite low up till now if you see that. But overall, one thing that I also want to emphasize that it's not that GBS has come for the first time. You know, in very, very low, this thing, it has been there for some years, and regularly, even last year, we had few cases that came up from GBS point of view. But probably because of a cluster in a specific area, this year it has become like that. But what you said, I think the whole administration has been on toes, right from the highest levels in the government, from the health department perspective, and then at the local level, at PCMC level also, all our departments have been on the toes with regards to that.
So can you help us to know exact measures you've taken?
Yeah. So there are two components of how we are tackling this thing. First component is with regards to, say, water supply. So there we are trying to do a couple of things. We are trying to take samples. So earlier we used to take 200 random samples every day. Currently we've doubled that number to 400 random samples throughout the city. Second, we have started to take samples from the private wells, from where some private tankers also take water. We are also trying to disinfect those private wells, even though that is not in the purview of the corporation, but within this point we are trying to do that.
Tentatively, any idea how many samples
about
have been
26 wells, 26 wells, and overall we've taken more than 900 samples.
Because wells are considered to be the hotspot for this.
So overall,
disease.
we don't supply any water from PCMC side from wells. It is through our own water treatment plants. So we don't have any supply system from wells. But sometimes there can be few private wells from where private tankers are supplying water. And we are trying to take care of that. We are trying to take care in the societies also, trying to create IEC along with the society members. Apart from that, we are also beginning to check the samples in the water jar bottling plants.
Okay.
Because that is also sometimes in a 20-liter water jar bottling plants also, and we are taking samples. We are trying to ensure monitoring over there as well. So this is with regards to the water supply paradigm. We are also trying to check, re-verify all our SOPs are at our water treatment plant in Ravet and Chikhli also, and trying to ensure that we have the minimum doses required that is required in the water to be present. Second aspect, which I said, is from the medical perspective, which is the curative part and the preventive part. In the preventive part, all the patients, like these 14 to 15 patients that have come in PCMC, we've made more than 16 survey teams who have surveyed almost now about 2,800 households to try and determine if we have a particular patient in a household, are there other cases around? So we tried to take a whole neighborhood approach where we are trying to see whether someone has a sudden onset of weakness, whether someone has a, particular these symptoms which are there in the GBS as we are trying to see. Second part is the curative part for the patients admitted in our hospital. So we've designated 2 hospitals, YCM, and we've designated Thergaon. So there are a total of 76 ICU beds in both YCM and Thergaon. PCMC is absolutely equipped enough.
So from hospital perspective, you are equipped.
From hospital perspective, we are equipped. The government of Maharashtra has taken a big decision for including this in MJPGY from a package perspective. So there is 2 lakh rupees for the IVIG injection, 80,000 for another treatment of this, and 60,000 for management of GBS.
So shall I presume in your region people are not facing financial issues as far as treatment is concerned?
So I would not say that, absolutely. So patients are being treated in YCM and patients are being treated will begin to be treated in Thergaon going forward. We have designated Thergaon also.
Okay.
Both are our own hospitals. We have enough supplies of IVIG. IVIG is not an issue. Directions have also been passed by the health department and in the meeting that got there in the divisional commissioner office also. Even if the private hospitals will be facing a crunch, we'll be providing that provision of IVIG, etc.
Great. Any numbers with reference to ventilator? I mean, are there any
So,
patients on ventilator?
absolutely, we are absolutely equipped with regards to ventilator. There are 6 patients in the ICU, out of which around 4 are on ventilators, all stable for now. But
If
we
need
are
be, you
having
have sufficient ventilator facility.
absolutely sufficient ventilators. I think because of COVID, we are absolutely well equipped, well stocked with ventilators, their consumables, etc. So ventilators is absolutely not an issue.
Any message to the citizens?
I think the message to citizens through you would be, in general, very old age wisdom about boiling water. We would request all of the citizens to ensure maximum possible to boil the water before they use. In few particular areas where we feel the need, we are also distributing Mediclor tablets, and we are trying to also tell people how to use those Mediclor tablets. But we are not doing it throughout. Not everyone needs to do it. The best thing that you can do at your level is make your immunity better and boil the water before using.
Noted. Thank you so much for spending Punekar News.